Mike, you mentioned durable immunity in your answer, and that leads me to some reports that came out last week about more people getting reinfected with SARS-CoV-2, including a patient in Nevada whose second infection was reportedly worse than the first. Do these infections raise any concerns about immunity?
We knew that we would start to see reinfections in individuals just based on what we knew about coronavirus infection and immune response. So these aren't surprises. No one should suddenly say, oh boy, this is something we didn't expect. We did. What we don't yet understand is what the long-term implications are. Remember, this pandemic, for all intents and purposes, is 8 months old. And in countries like the United States, it's really been, most of the transmission has been in the last 4 months. So that when we think about someone getting infected, developing an immune response, having that immune response wane, and then being exposed again and getting infection, you would expect that, it won't happen for months and months. And so if we're seeing them now, this is just the beginning of what's coming. The other thing that is very important to understand is most reinfections probably will never, ever be documented at this time, because in the ones I'm going to talk about now, just by chance, the individuals had a virus isolated or genetic material available from the swab to determine what the first isolate of the virus was 2 months ago or 3 months ago, and what they have now, so that we could say, different viruses, it had to be reinfection. Whereas, if it was the same virus, you could argue theoretically they were chronically infected. So I am now aware in the last 9 days of 8 different reinfection cases that have been documented, most in Europe, one here in the United States, and one in Hong Kong. The Hong Kong was the first one that came forward. This was an individual who was infected last March, who basically, after his infection, which was a relatively minor illness, had a virus cultured, recovered, and then was traveling to Europe 2.5 months later. And at that point, on his way back into Hong Kong, was retested. 33-year-old man, and otherwise doing fine. At that point, when he was found to be PCR positive again, it was a curiosity issue, and they cultured him and found a totally new virus. And it happened to be a virus that genetically looked very much like the ones that were circulated in Europe at the time. Quite good proof that there was a second infection. For all the infections except one, the evidence has been that the cases were milder, or in some instances didn't even know they were infected. But there was one case that has triggered a real question and concern. And this was a case that occurred in a young 25-year-old resident of Reno, Nevada. And he first tested positive for SARS-CoV in April after coming down with a sore throat, cough, and headache. He had some nausea and diarrhea, but he got better over time and subsequently tested negative twice. He then recovered. He was fine. But then some 48 days later, the man started experiencing headaches, cough, other symptoms again. Eventually, he became so sick that he had to be hospitalized and was found to have pneumonia, and a complicated case at that. Genetic material from the swabs that had been obtained in his first illness were still available, and the genetic material from this swab with his second illness was available, and when comparing them, they were different viruses. And so it could be demonstrated that he was actually infected a second time. Now, what does this mean? Well, we're not completely clear yet. I don't want to sit here and say, oh my, we're done. But at the same time, this has been a challenge we've all worried about. We don't know what durable immunity is. So if I go back to herd immunity, remember that infers that there's some immunity there. But if this wears off over time, we may get some new people joining the herd immunity crowd and some falling out because they've lost their immunity. We don't know. This also is unclear what it means for vaccines. So this is what makes this virus kind of the classic we call disease X, kind of that bad bug that we could all have dreamed would never happen, at least hope not, and might be happening now. If this were influenza, I'd feel very confident that immunity among those who had been infected, and even to a real degree, a substantial number of those vaccinated, would be protected for some time to come. Here, we don't know. So this is a stay tuned moment. This is one where, again, we have to be incredibly humble and say, we got to follow this closely. We're going to need to make sure we understand more and more about reinfection cases, because so many people today would not be in a position of having a first and second virus available. So even if they were reinfections, we wouldn't know it. So to summarize, let me just say that, this isn't a reason to go off, the sky is falling, but this is concerning. This is concerning. A concern that we had already. We thought this could happen. We're hoping it wouldn't, but as you well know, and I've said many times, hope is not a strategy, and it surely isn't here. But we have to understand that this could have some real implications down the road. It has implications not only, by the way, for vaccination and how well you're protected, but do we need booster doses, which would add substantially to the efforts needed and the amount of vaccine needed to deliver. I mean, we're already talking about 2 doses just to get primed with the first set. Would you need a new dose every 6 months, 12 months? Would they work? What would happen? So we have so much more to learn about this disease and this infection, and this is right at the top of the list.